Hello, I am Dr. Wade Sadler. As we approach World AIDS Day, let's have a discussion about HIV and AIDS. World AIDS Day helps to promote, support, and care for persons living with and affected by HIV and AIDS. It also helps to remember those who have died from HIV and AIDS. HIV is the human immunodeficiency virus. This virus attacks and infects the white blood cells of a person's immune system. If left untreated, this can lead to a disease called AIDS. AIDS stands for the Acquired Immunodeficiency Syndrome. It may also be referred to as a late or advanced stage of HIV, where the person's immune system is severely damaged and severely weakened. It's important to also note that every person with AIDS has HIV, but not every person with HIV will develop AIDS. How is HIV transmitted? Well, the virus may be transmitted through bodily fluids, through broken skin, through blood transfusions with HIV contaminated blood, through unsafe sexual acts, through mother to child during pregnancy, during breastfeeding, or even during delivery. HIV may also be transmitted through needle stick injuries. Who is at risk for getting HIV? Now, persons who receive blood transfusion with HIV infected blood, persons who engage in risky and unsafe sexual practices, for example, persons who have multiple partners, as well as MSM workers, persons who work in the healthcare field, persons working in the lab or in prisons may also be at risk. Persons living in an area with high HIV cases may be at risk. Persons who share contaminated needles, such as during IV drug use. Persons who also have a current or a recurrent history of sexually transmitted infections may be at risk, and neonates may be at risk from an untreated HIV infected mother. Now, we cannot tell by looking on someone that they have HIV. The signs and symptoms of HIV vary, as well as the signs and symptoms for AIDS. It is important to do voluntary screening for HIV, especially those who are at high risk. You can go ahead and request a rapid or an ELISA blood test from your doctor or any of the screening sites available island-wide. Though HIV remains in the body for a lifetime, this is not a death sentence. There are available medications to keep persons living with HIV and AIDS alive and well. Antiretroviral medications are available, and these work to inhibit the replication of the virus in the body. Some persons may use alternate or complementary medicine, such as acupuncture or herbal remedies. These medicines are used along with the antiretroviral medications. They are not a substitute. Even though there is treatment, we must encourage prevention of this debilitating condition. What are some of the HIV/AIDS prevention strategies? An important strategy is to encourage change in beliefs and behavior through public education. Another important strategy is promoting abstinence, safe sex, discouraging the sharing of needles, to continue thorough blood screening, also employ universal precautions. Universal precautions help prevent infection, and such measures include the use of barriers such as gloves, masks, goggles, and gowns, frequent hand washing, sanitization of surfaces, clean linen, proper disposal of garbage as well as needles in the relevant containers. Persons should also be encouraged to cover open wounds and cuts. For persons in the workplace, it is important to follow the 10 guiding principles of HIV/AIDS in the workplace. Number 1, we have to recognize that HIV/AIDS is a workplace issue as well. There should be no discrimination on the basis of real or perceived HIV status. There should be gender equality. There should be a healthy work environment. And there should be discussion for a workplace strategy for HIV/AIDS. Screening for HIV should not be done to exclude anyone from employment. Confidentiality for HIV status is also important. A continued employment relationship should also be maintained within the workplace. There should be the implementation of these strategies that were discussed within the workplace, and there should definitely be care and support for infected and affected workers. Remember, HIV is not a cause for termination of employment. There should be equal employment opportunities for all. We must come together and share the responsibility to end the stigma and the discrimination against persons with HIV and AIDS. It is important not to discriminate, but to assume everyone may be infectious and carry out universal precautions to keep ourselves safe. Let's step up our efforts in public education on prevention and treatment for HIV and AIDS. Let's increase our testing, know your HIV status. Also important is to increase the care and support of persons living with and affected by HIV and AIDS. Let's do our part and unite and address HIV/AIDS, as well as support each other and make everyone safe.